Hi, my name is Machiko Minegishi. I'm an MPH student at TH Chan Harvard School of Public Health and also on MCH concentration. It's my pleasure and honor to present and introduce Professor Peter Szilagyi. Professor Szilagyi is an accomplished health service researcher, and professors studies to improve the quality of care and outcomes for vulnerable children have led to important changes in immunization delivery, child health care financing, and care of children with chronic conditions. Professor Szilagyi is principal investigator or co-PI on multiple R01s and other grants. At UCLA, he leads the department's research efforts, the Special Population Program within UCLA's CTSI. Nationally, Dr. Szilagyi has served on study sections at AHRQ, CDC, and NIH. He is a pediatric editor of the Bates Guide to Physical Examination and History Taking, which is one of the world's top medical textbooks, now translated into more than a dozen languages. Professor Szilagyi is very much involved with the Academic Pediatric Association. He served on the APA's board of directors for 16 years and was APA president in 2008 to 9. Since 2009, he has been editor-in-chief of Academic Pediatrics, Journal of APA. Please join me welcoming Professor Szilagyi.
Thank you so much, and it's really a pleasure to honor you, Marie, and to speak at this symposium. I'm a little bit unused to not giving scientific talks or talks about pediatric practice, but I tried to put together a little bit of a different talk. I knew there would be many junior individuals at this symposium because, Marie, you influence so many people. And so I think most of my talk is directed toward people who are more junior. They asked me, the planning committee asked me to discuss challenges in health services research and maternal child health research. So for the next 4 hours, I think I'll give you all the challenges in health services research. I'm going to call it HSR, but substitute MCH for HSR because really the challenges are the same. This is Marie when she was younger pushing the rock up the hill. You've all seen for different versions of this slide. And what I'd like to do is talk a little bit about just a few challenges in HSR or MCH research: funding, training, connecting, and disseminating. So you've all seen versions of this as well. Obviously, I'm not just going to talk about challenges. John Kennedy, I think, John F. Kennedy maybe said it as well as anybody. The Chinese use 2 brushstrokes to write the word crisis or challenge. One brushstroke stands for danger, the other for opportunity. So in a crisis, be aware of the danger, but recognize the opportunity. I feel we're in a crisis today in many, many different ways, and it's up to us to create opportunities out of this. So let me just go through a few challenges with potential opportunities, and throughout this, I'm going to sprinkle lessons from Marie. I must admit I'm a little bit jealous of most of you because you work face-to-face with Marie. Most of my interactions have been through the journal, so it's by phone or email or other interactions. So I think most of you have had even closer interactions, but I've taken a lot of lessons from Marie. So this is a slide from Bill Hay, just showing dollars for NIH. So this isn't MCHB, CDC, ARC, foundations or industry. This is just dollars from NIH that are devoted altogether, and the pediatric component of the dollars. So on the left-hand side is billions, and on the right-hand side is the percent that is pediatrics. And you can see it's been somewhat steady. It hasn't gone up. If you look at the blue, the dollars for pediatric from NIH at least has not increased. One could argue that it really should increase. Certainly the competition for dollars has increased. And so as I'm sort of facing a lot of young people in the audience, one of the challenge, obviously, is funding. So how do we meet some of the HSR or MCH funding challenges? And these are some lessons from Marie. So first, pursue an idea that's important and lasting and relevant. So for me personally, after the measles epidemic in 1988, I launched into trying to raise childhood immunization rates. And 30 years later, I'm still trying to raise childhood immunization. So obviously I've failed, but at least the issue is important, lasting, and relevant. And I think if you look at Marie's career, you will see this. Build career skills. So one of the ways to get ahead is to become the best at the skills that you are doing, whether this is analytic or study design. It takes a lot of self-reflection to figure out what you are good at. Collaborate. I'm going to talk a lot more about collaboration, obviously. Take advantage of your environment. I was in Rochester, New York for 30 years before moving to LA and UCLA 3 years ago. And the Rochester environment, this is where Bob Haggerty was a lot, Jim Perrin and others here, was this very unique environment where people collaborated a lot. We were able to create and build a community laboratory. I haven't been able to do that yet in LA. There's sort of different types of challenges, but take advantage of your own environment. Diversify your grant portfolio. Many senior people here have had grants from multiple different sources. I don't think I've really seen a graph that shows the direct relationship between the dollars that come in and the impact on children. Some small grants have had, and some non-funded studies have had major impact on children. Many of you have done these studies, but you need to diversify your portfolio and persist. Did I say that enough times? That is maybe the one characteristic that leads to success. Training. There are many trainees here, and it's so nice to see the people who are introducing the speakers being trainees. So here's some challenges in HSR MCH training. There's few training programs. So I'm looking at it from mostly the lens of academic general pediatrics. This slide shows the number of academic general pediatric training programs, not in one state, but across the United States. There's very few, and a number of hospitalist programs across the United States. This is the number of academic general pediatric fellows that are being trained across the United States, which is unbelievably small. I actually don't know the number of hospitalists. It's more than the number of academic general pediatric fellows. There's also variability in training, which is one reason that I and a group of individuals have been trying to get very involved in evaluating and accrediting academic general pediatric training programs to try to reduce the variability in training and bring the level up. And these are the number of training programs that are actually accredited already by the APA. There are few applicants, and what I hear from you all is that there's few jobs, and that's partly true. So here's some lessons from Marie. So there's few training programs. Well, we need to capitalize on other programs in our institutions. At UCLA, we don't have a general academic pediatric fellowship program. We honestly don't need one because there are HSR, there are other type T32s, there are other programs, and we actually train a good number of general academic pediatricians just based on that. MCH could use that same concept. Marie has. Variability in training, I talked a little bit about the accreditation process, and we need to do better about sharing what works and sharing successes. Few applicants, too often we sort of focus on certain kinds of applicants. In the MD field, we focus on MD applicants, but I think PhD trainees are as important as MD trainees. We also need to nurture trainees really early, earlier than we are doing right now. And there's few academic jobs. I mentor a lot of people. One of the advice I give to some people is you need to sort of think ahead about your job and think in a flexible way about your job. And I'll talk a little bit more about this, so sorry. Okay, connecting. I want to talk about two aspects of connecting with lessons from Marie: mentoring and being mentored, and collaborating with others. So mentorship. So how many people here are proteges of Marie? Wow. Look around. That's amazing. For those of us, I think I probably spend 3 or 4 hours a day mentoring people. It is by far the most important activity that I do, by far my favorite activity. So it is so important to develop and maintain really effective mentor-protege relationships. Why do we need mentors? It helps us become better. It accelerates our academic growth. My guess is many of you would get there, but having Marie mentor you gets you there much faster. It enhances our organization or our institution. It's kind of like an acculturation. We all know the idiosyncrasies of our institution, and mentors do that. It fulfills the circle of academic life. I'm pushed by my protégés a lot, and I learn a lot from my protégés. And therefore, it provides meaning, more meaning than I get out of almost anything career-wise. So this was written by somebody else, but think about Marie. Mentors are guides. They lead us along the journey of our lives. We trust them because they have been there before. They embody our hopes, cast light on the way ahead. They interpret arcane signs, warn us of lurking dangers, and point out unexposed delights along the way. So think about your own mentors, and I hope they have done this for you, and I hope you do this for others. So I'm not going to go through this, but looking at Marie's CV, she's had these doctoral students, postdoctoral, scholarship oversight committees. The numbers are incredible, but what's even more incredible than the numbers is the sort of the successes and performance and passion of her protégés. So one way of connecting is mentoring, and spend a lot of time in these kinds of relationships, more time than maybe you think you should. What about collaborating with others? In preparing for this, so I've only been at UCLA 3 years, I kind of tried to draw a social network, not Facebook, but the other kind of social network from my own professional collaborations. So here's who I collaborate with, and I'm not special. Academic general pediatricians at UCLA. This is locally. Pediatric subspecialists, a lot. Internal medicine, biostatisticians, economists, health system leaders, CTSI leaders, and community organizations. You were just talking at the last panel about silos. UCLA is filled with silos. So what you need to do, people were asking, Jonathan, you were asking how you address silos. I sought out most of those collaborations, and many of them are new or created new. I'm not special, I just sought them out. And people are more willing to collaborate than you might think. You know, in my mind, the best way to address silos is head on. Collaborating externally. I'm not going to go through this because you've seen this slide many times. These are some of Marie's external collaborations, and I think a lot of her impact is through this. Why do we collaborate? None of us ever do great things, but we can all do small things with great love. And together we can do something wonderful. We've seen evidence of this throughout the day today in Marie's successes and achievements, and in the successes and achievements of all of you. So disseminating. I actually don't have a slide on disseminating, but maybe we'll get back to that in terms of the panel discussion, because we may be running low. So I didn't put this initially, but to me, this is the biggest challenge of HSR or MCH, which is impacting. And you've heard that word a lot. So I do want to spend a little bit of time talking about impacting. How do you make an impact through HSR or MCH? How do you individually and collectively make an impact? Because that's actually what really counts. It's not your CV. This is what really counts. So I think one way is to really reflect on what is your academic sweet spot. It's different for you than for me, but what is your academic sweet spot? And here's sort of my thought. This isn't brand new. What is important? What's important for you? What's important for maternal child health? What's important for children, for me, for primary care? What's really important? What are your strengths? So for me, my strengths are not, the reason I work with all those people is because I don't have the expertise that all those people have. So, but my strengths might be bringing them together and energizing a group and making the group better as a group than individually. What are your strengths? And what are you passionate about? What are you really, really passionate about? Not because somebody wants you to do something, but because you are passionate about that. Remember I said persist, persist, persist. It comes out of passion. It really comes out of passion. These three, the intersection of these three, is your academic sweet spot. which will make you smile and allow you to succeed by standing on Marie's shoulders. So go beyond research. This is a little bit of the dissemination. So even though much of what I do is research, for me, I've tried increasingly to go beyond research because I think research can only bring you so far. So some of this is through the APA activities. Some of this is through the journal. I mean, many of you are editors. Jim Perrin started this journal. It's mostly service to the field. It goes beyond research. Impacting locally. So junior people, it's easier to impact locally than nationally. There is a lot more that you could do than you might think in terms of impacting locally. For me, it has been through fellow and faculty development and through community activities. Let me just give you one example. So I directed this in Rochester, what was called a primary care outreach program, which was an outreach program. This is similar to what Michael was talking about. It was a personalized approach to low-income individuals to try to get them into primary care or immunizations. It wasn't one size fit all. It was based on a social work model, sort of based on a British model. We demonstrated significant impact on improving immunization rates by 20 percentage points. And it improved well-child visit rates and all sorts of other things. So we published some articles. That's cool. But my big accomplishment was I was able to convince all of the hospital systems and the HMOs, all of them in Rochester, New York, to co-fund the program. And so for 20 years, it's been funded. No more manuscripts or anything coming out of it, but it's been funded and is continuing to run in Rochester. And there's zero disparities in immunizations in Rochester, which is something like the 6th poorest city in the United States. So go beyond research. It's not just research. National things and national committees. Has anybody ever heard you say, well, say no, say no, say no, you'll advance better? Well, I think you need to learn to say yes. You need to go to your mentors to figure out what to say yes to. But the reason Marie's been so successful outside of Harvard is because she says yes to many things, and those things don't necessarily, add to her academic CV. It's because they do important things. So just in terms of our interactions, and I'm almost done, Marie was a founding senior editor. She has leadership and methods papers. She's our methods guru. She has run the ARC-funded annual report that somebody talked about before, and she's given a lot of advice. And maybe most importantly, I think I heard this as a constant theme here, she sets the standards really, really high, right, for the journal. And I think maybe that is her biggest accomplishments. So challenges of HSR, in my view, funding, training, connecting, disseminating, and most importantly, impacting. And so, my final words, there's challenges on the left side, but maybe one of my biggest lessons for Marie is find joy in health services and maternal child health research. Find joy in academics and what you do, and you will succeed, and you'll make this world a little bit of a better place, just like Marie has, and I thank you very much.